It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
And welcome to UofL Today with Mark Hebert on 93.9 The Ville. As most of you know by now, this is a show about all things University of Louisville. We talk about research, we talk about health issues, we talk about great students, all the good news coming out of the University of Louisville, and hopefully for the next half hour you'll stick around and learn something from this program. So what have we got coming up on the show today? Well, she came from Iran to the United States and UofL 4 years ago to pursue a degree in computer engineering, and today Mahsa Badami is sharing her story in the hope of inspiring other young women to pursue engineering, especially women in her home country, and we'll be talking to her. But first, you know a lot about the statistics. You've heard them all about Kentucky's health. We're among the worst in the country for heart attacks and cancer. We eat poorly. We don't exercise enough. In other words, we as a state really stink when it comes to our health. Ben Chandler is a former politician, I think he would say a reformed politician, a former congressman and state attorney general who now heads the Foundation for a Healthy Kentucky. And Dr. Gil Liu is an associate professor and director of the Division of General Pediatrics in the U of L School of Medicine. And he's also now the medical director for the Kentucky Medicaid program. And they're both sitting right in front of me, ready to talk about health issues facing the Commonwealth. Hello, Ben.
Well, hello, Mark. And the first thing, of course, I'm very happy to be here at U of L. Always happy to be at U of L. Mm-hmm. And I want to say something about Gil Liu. He's a man who wears a lot of hats.
He does.
And he's got those hats. And the other hat he's got is he's the endowed chair of our foundation at U of L. One of the first things our foundation did when it was created was to give basically $2 million to the University of Louisville for the purpose of endowing a chair in urban health.
Right.
And Gil's
the
that guy.
Man, huh?
Yes,
so he's got like 14 different hats.
I'm
instead
telling
of just
you
3.
now.
Okay.
I don't know how Gil just doesn't sleep. That's all.
And the foundation also endowed a chair at the University of Kentucky. Same thing
for rural health.
For rural health.
That's right.
Okay. Mm-hmm. So both the universities appreciate that from the foundation.
Yep.
Well, Ben, you are the head of this foundation that has done some polling and some surveying over the years about the health issues facing Kentucky. So let's just start with there, and then Gil, you can kind of jump in and talk about what the state and what U of L are doing to kind of attack some of these issues. So,
sounds good, Mark.
So Ben, what are some of the things that as you do some of these polling things and these surveys, what are you finding that Kentuckians are saying are the biggest health issues facing Kentucky among the many we have?
The surveys have been very interesting, and we've surveyed on quite a number of issues over the years. But what comes up pretty regularly is, of course, Kentuckians are worried about cancer. They're worried about whether they have insurance or not. Mm-hmm. Access to insurance is important to them, and the issue of obesity is important, and they understand that leads to so many other health problems. But the cancer thing sticks out, and it sticks out here in Kentucky because we are in the unhappy situation of having the highest cancer mortality in this nation.
Right.
More people per capita die of cancer in the Commonwealth of Kentucky than in any other state in the country. And my feeling about that is that's unacceptable. We've got to do something about that, and we've got to do something about it right away.
We're number one in a bad way.
Oh, and I can't think of any worse thing to have that statistic attached to. You know, what's worse than having cancer? Not much.
Right. And so people are worried about that.
Yes, they are.
And there are a number of factors, Gil, that factor into that, right? I mean, we smoke too much and some of the other factors, but is some of it also environmental in Kentucky as well?
That's a great question, Mark. And it is a situation, cancer, that arises from a number of different causal factors. An individual's genetics, their behavioral choices, the environment that they live in, and then the care that they get. So, there are many targets within each of those types of factors. For example, another golden opportunity for our state is to increase the number of cancer screenings that we deliver so we can catch disease early. Usually when you catch it early, the treatment is more effective. We have one of the highest rates of tobacco use.
The highest.
The highest.
We are now number one in the use of tobacco.
We buy 1 and 2 often.
Yes, okay. Yes.
Okay. And that's a great policy target. There are lots of ways that lawmakers can come together and enact regulations to reduce the amount of tobacco use. Mm-hmm. So I love, I did want to say thank you to the foundation for being a benefactor and enabling the university to do more research around health policy. Really what we need to do every time is make sure that the rules that we make are completely grounded in evidence.
Yep.
And often that is not entirely clear. Another golden opportunity is when you do the evidence generating at a university, you get to train people to be detectives and good scientists and really be a part of solving that problem. And then that connects with things like schools of law, schools of public health, schools of medicine.
A lot of people working towards the same target.
Yeah, and it takes a lot of different types of people on a team to come up with a good solution.
Right. So, Ben, what is the foundation? I guess I should have asked this right off the top. What is the Foundation for Healthy Kentucky?
The Foundation for Healthy Kentucky is a 501c3 foundation that was set up as a result of a lawsuit that was filed many years ago to get charitable assets that an insurance company had taken. And we got $45 million. It's now up to $52 million, and we've given away about $27 million over the last 15 years. But it's a foundation, hopefully, that will be there in perpetuity. And the idea behind it is to be a driver for good health for our people. There's only one thing, really, that the foundation's interested in, and that is seeing that the people of Kentucky are healthier. And that's a big job. As you said, to start this thing off, we've got enormous health problems in this state. So we've got a big job in front of us. I guess the good news is there isn't anywhere to go but up. but that's what the foundation wants to do. We want to be a leader in policy. And as Gil said very well, evidence-based policy. We want to make sure that the policies do, in fact, lead to better health. The policies that are enacted. And that's all we care about is better health for our people.
And along with the cancer, you talked about obesity and the problems with health insurance. So let's talk about obesity. We hear all the time that kids are too fat. They're drinking too much soda. They're eating too much fatty food, those kinds of things. Is Kentucky any worse than anybody else when it comes to childhood obesity?
Yes, we are. Well, I think we're in the high 40s. We're 48th or 49th in that neck of the woods as far as obesity is concerned. And child obesity, we're tremendously high, too. Mm-hmm. And that shows up in diabetes, high diabetes rates. It shows up in high rates of heart disease. Our rates of those things are tremendously higher than the nation at large.
As the kids get older, they carry these problems with them.
That's exactly right. And they adopt those problems at an early age. Now, Gil knows more about this than I do. So what's
UofL doing about it? Again, how's UofL fit into this equation?
Well, again, speaking from the standpoint of an urban health policy researcher, when you think about children, you really should not blame, especially a young child, for being overweight. By many respects, they are a product of their environment, their family environment, their school environment, the neighborhoods that their residential address is located in. And so again, I think that really illustrates the opportunity that community leaders have to build a healthy place where kids have a very low risk for becoming overweight. You asked specifically about what UofL is doing, and I can think of two really exciting projects. So for young children, they spend about 2/3 of their lives in school. Especially for children who live in families that are facing poverty. They typically get lunch and breakfast from their school 5 days a week. And much of the exercise and physical activity they get are on school playgrounds. So we're involved in a project called the Compassionate Schools Project, where we're studying how to teach children to really be mindful of their healthy behavior, how they can eat a good choice of nutritious foods, stay active for their entire lifespan, and think about how they relate to other people socially. And there's lots of innovative approaches to that, giving them different types of activity, because we know not all kids are, athletic jocks.
Right. Yeah, they're not going to get out and run around and hit the baseball, yeah.
Letting them try a lot of different foods that they might not get from their families, and we're doing it in a rigorous trial. So there are some schools that are getting the program, some schools that aren't, and that'll allow us to conclusively demonstrate was this program effective? One other thing I'll briefly mention is we know there's interesting new knowledge around how clean our environment is, or when it's polluted, how that connects with things like your weight. Turns out that in cities where we have a lot of automobile traffic, there are these fine particulate particles that pollute our air, and those things cause inflammatory responses in the body that ultimately may lead to obesity. We've got a project going on with a local parochial school, great public-private partnership, where we've planted a large garden with big trees and bushes that are cleansing the air, and then we're measuring from a biologic standpoint with blood sampling, behavioral surveys.
Right. That's Aruni Bhatnagar's
Aruni
study,
Bhatnagar,
isn't it?
the Green
Research,
Art Project. So, and again, really, if he finds that this produces better health, it's time to hand it over to the lawmakers and the leaders of the city to build cleaner environments, healthier schools, and greener neighborhoods.
Are we sure we want to leave it up to the politicians to do that?
Well,
that's a whole other story, I suppose. Isn't it?
Unfortunately, Mark, to some extent, we don't have any choice.
Yeah.
And that's where the foundation comes in. And we're trying to move into a role of informing, advocating, and trying to convince our leaders, both on the local level and on the state level, that these are important matters to take up and to do something about.
And you're trying to get the data to back it up.
That's right. And Gil helps us get the data. And we take that data and we try to convince our legislators that they need to do these things on behalf of our citizens. There's so many things that need to be done, but you've heard maybe of movements here in Louisville, health in all policies. There's been a lot of talk about that.
We're talking with Ben Chandler, who's the head of the Foundation for a Healthy Kentucky, and Dr. Gil Liu, who's an associate professor and director of the Division of General Pediatrics at UofL School of Medicine. He's also the medical director for the Kentucky Medicaid program and an endowed chair endowed by the Foundation for Urban Health. What's it called?
For urban health in
For urban
Kentucky,
health.
that's
Very good.
right.
All right, well, let's talk a little bit. Ben, you said that one of the latest polling found that Kentuckians were really concerned about health insurance. That was one of the top issues. So give us the numbers and what you found.
Well, that was one of the top issues, and there is a concern. Now, the good news here is that, as I think has been very well publicized, we have cut our uninsured rate tremendously. Now, we've cut it because, frankly, we've had Medicaid expansion here in Kentucky, and a whole lot more people have been put on the Medicaid rolls, and a lot of that has to do with our financial situation in the state. We have a fairly high rate of poverty or near poverty, so a substantial proportion of the people in the state were eligible to be put on Medicaid. As a result of that, we have cut our uninsured rate down to the lowest in this region. We were really one of the highest in this region of people who are uninsured. Now we're one of the lowest. The reason that's important to people is that they have the ability to get preventive care. It's very important. Now, preventive care is something we don't talk about enough. We basically, in medicine, we have what I would like to refer to generally as a rescue system. We put most of our resources in rescuing people once they're already sick. And very few of our resources go into trying to keep them from becoming sick in the first place. And in my mind, that's what having insurance helps do. It helps people try to prevent becoming sick in the first place, and ultimately it saves our state, the taxpayers, the whole system. It saves a lot of money.
I don't want to get into the politics of what kind of insurance we should have and what kind of insurance system we should have in the state of Kentucky, but what I do want to ask is, why do you think people are concerned about health insurance when now we do have all these new Kentuckians covered by either Medicaid or under Obamacare? So why are they still so concerned about health insurance when the overwhelming majority of Kentuckians now have it?
Well, I think, first of all, there are several 100,000 that still don't. But beyond that, I think there are a lot of people who believe that their health insurance is either risky, that they may not be able to keep it, or that it's too expensive.
Too expensive, or has too high deductibles, I suppose.
Well, that too. All of these things, it's very complicated,
Right.
but of course the too high deductibles make it too expensive. You know, it's
Right.
in any event, there are a lot of people who are concerned about the expense of their insurance. That's nothing new, as we know. I mean, insurance rates have been going up for years, and the cost of health care has been going up for years. That's a tough nut to crack. Right. That's very difficult to.
It's not an easy one, as Donald Trump is finding out.
He found out it was complex.
We all know it's complex. It's complicated. Go figure. I know that was a shocker to many of us that health insurance and health care reform is.
Well,
is a
that's
little
right,
complex.
and you know, the other thing I think that's of concern to people on the subject of health insurance is it is always a political football. We're talking right now, both on the state level and on the federal level, about what to do with health insurance. You know, they're talking about health reforms on both levels. So, you know, it's not a certainty that people who have insurance will be able to keep it.
But people are concerned. All right, let's talk about one other thing that I know both of you want to talk about. The most significant thing I think that came out of this year's survey from the foundation was the support for a smoke-free law in the state of Kentucky. Right now in Louisville and several other communities, Lexington, several other communities, smoking is banned inside all buildings, and there are smoke-free. It's a smoke-free law in those local areas. Now, apparently, according to your poll, support is growing for doing that statewide. So describe some of the results you found.
First of all, let me describe what we mean by smoke-free. When we say all buildings, we mean all buildings to which the public has access.
Correct.
Essentially, workplaces, restaurants, government buildings, those types of things. It doesn't mean your own home.
Right.
I
think most people knew that.
Well, I just want to make sure
Okay.
that that's clarified. That is the case.
So what'd you find?
71% of the people in this state believe that we ought to have a statewide smoke-free law.
That surprise you?
It did surprise me, particularly in a state with such a deep tobacco heritage. You know, we've been a huge tobacco-producing state, and here in Louisville, you know, we had so many jobs connected to, among other things, manufacturing cigarettes.
Right.
You know, and corporate headquarters, Brown and Williamson. Long history of a tobacco culture in Kentucky. So with 71% feeling this way, I've got to think that the table is set for us to get a statewide smoke-free law. Why is that important? It's important because the evidence, as Gil says, evidence is very, very important. The evidence tells us that if we get a smoke-free law, the rate of smoking will go down and the rate of cancer will go down, and the expense to the taxpayers for health care will go down.
Right.
All of those are extremely important things to have happen.
Gil, thoughts on this one? Dr. Liu?
Yeah, well, if I could take a moment, Mark, you opened the show with kind of reminding us about how poorly Kentucky fares when compared to other states. And that's been a long-standing observation. We've been at the bottom of the pile for decades. So I think what that illustrates is we just cannot continue with the current system. How could we, year after year, accept being among the least healthy states in the United States? And against that, we're spending more and more. So it's not just we've been terrible and we're stuck there, but we're pouring greater amounts of dollars at it, but we really haven't budged.
Haven't moved the numbers.
The needle. So I think, and then, you know, you went on to talk about how cancer has a lot of different factors that ultimately end up in the disease. And I think that things like smoking regulation, it just shows that there are many opportunities both inside and outside of the healthcare system to make some progress, to appeal to the data and just make a solid decision that's really hard to debate.
But as a doctor, I assume you're for statewide smoke-free law.
I
can't be
absolutely.
against it, can you?
Well, you know, what's the
as a
argument?
doctor, not as a politician, but as a doctor, I understand why some politicians are reluctant to and want to pass such a law. But as a doctor, there's no way you can be against that, can you?
Yeah, you know, when we take care of patients, the best approach is not me as the expert telling you what you have to do. and you doing it because the expert told you. It is two respectable individuals talking about really what's most important and then giving it our best shot. So, do I think that people who smoke are not bright and not wanting the same things that I want? No. But somehow we've got to find a common ground for, when we really get down to what we care about the most and we want to do the right thing because it's evidence-based, I think these smoking regulations are just abundantly the right thing to do. I kind of like to take care of my community like I take care of patients, with a lot of input, a lot of partnership, and a lot of agreement.
Ben Chandler, Dr. Gildu, thanks for being on the program. Mahsa Badami is from Iran. She earned her PhD, or she's earning her PhD from the University of Louisville. And she's got a message for young girls and a message for all of us, I guess, about what you can do and what you can accomplish if you put your mind to it. So, Mahsa, welcome to the show.
Thank you so much. Thanks for having me.
Okay. Well, by the time this program airs, you're going to have graduated with a PhD, right?
Yes, actually, last week I finished my oral exam.
Okay. Congratulations.
Thank you.
And a PhD in what?
Computer science and computer engineering.
Okay. You're from Iran.
Yes.
How in the heck did you get to the University of Louisville?
Yeah, so it's a kind of interesting story that I was a teenager when I first saw Spielberg's AI movie, and it was about a robot that it was the first robot programmed to love, and it was adopted by a husband and wife, and they were interesting. It was an interesting movie.
This is a Steven Spielberg movie.
Yes, exactly, Steven Spielberg's. And of course, at that age, I was too young to plan for my next 15 years, of course. But now when I look back, I can tell that I was so captured by that concept that it was kind of built me a hope, dream in me that maybe someday I can do something, I can change the world. So it started with that movie, and then I decided to continue, decided to start computer science as my major in university, and then it was my bachelor.
Now, was that in Iran?
Yes, it was in Iran. Yeah. And then I didn't like that much, honestly. The first 3 years, I was, no, it's not me. I want to go and study art, and it was like that. And I was decided, okay, after my bachelor, I'm going to go and study something else. But last semester, we had a course called AI, and I started, it was like for me, it's boom, this is that movie. And then I started remembering that, and that book, I read it in a week. Of course, I escaped all of the math and equations, but for me, it was like a story, and I was reading, and I was like, wow, I really want to learn about it. It's so exciting. And then I decided to continue my education in master in AI, computer science and computer engineering.
And AI is artificial intelligence.
Yes, artificial intelligence.
So here we are.
Yep.
Okay, so you spent how long? How'd you get from Iran though to the University of Louisville? You skipped a step there. So how'd you get here?
Yes. So my master, it was in Iran. So after my master, again, I was captured by another movie, Beautiful Mind. It was about John Nash, and my master project thesis was on game theory. It was invented by John Nash. So you can tell how those movies had kind of influence on me.
Hey, you're a big movie watcher, aren't you?
Yes. Okay. Then during my master, my project was on kind of rescue the robots that they go and rescue human if there's a kind of disaster. So you can tell that it was really, really interesting for me, and I was like searching, and I wanted to know what kind of what other projects going on in the world. So I decided that I want to learn more. I want to know more, and I want to probably watch other movies when they are quick.
We've got lots of them in America.
Yeah, exactly. So that's why I started looking at different universities and several universities, and of course United States only, because I wanted to go somewhere that it's the technology, the entire technology is over there, and it has very good universities. So this is how I started searching universities. But I have 3 factors. One of them, I wanted to work in a lab that has the same same field of interest as me.
Right.
And the second of all, I wanted to work at the lab or under supervision of a female advisor, because at that time I really needed a role model. I really wanted to look up to some successful women and learn from them how, especially in our field, it's very hard. And third, of course, financial aid. It was an important factor for me. So I applied here.
UofL had all those things, so you wind up
Yes.
here. Okay.
Yes.
And you've been in Louisville for 4 years.
4 years and 4 months.
And describe what the difference is for you between the University of Louisville and the city of Louisville and what you had in Iran, your home country. What's the difference?
Regarding educational
Regarding
system,
education, social things, just kind of, everything.
Yeah. So the first thing was for me was in Iran. It's the relationship between students and like staffs of university. It's very, very formal. And when I came here, I saw that everyone is really friendly, and it's like that. It's your family, group of friends, and for me, it's very, very interesting. And I really, really love that culture. That they are so friendly and kind, and everyone is trying to help you.
We're talking to Mahsa Badami, who is a PhD student at the University of Louisville, and she's from Iran originally. So your message to women in the United States is what?
Go for it.
In the STEM fields?
Yes, in a STEM field, which is science, technology, engineering, and math. Sometimes young girls, they think that it's a major boy thing. They cannot do it. It's not true. It's not true. You can do whatever you want. Sometimes it may feel challenging. It's okay. Don't be afraid. Go for it. Ask for help. Look out for some mentors, and you can do it. Don't worry. Follow your dreams. You can change the world.
There you go. And you found some professors at the University of Louisville and the Speed School of Engineering in particular that you really latched onto and really enjoyed learning from, and you're kind of served as mentors to you, correct?
Yes.
So who were those people? And what did they do that was special to you?
Yes. So my advisor, Dr. Olfa Nasroi, I've been working under her supervision for almost 4 years and 4 months. And the first part was that she is really, really successful. And the first part that she was believing in me. And anytime that I said that I cannot do it, it's too much, she was just keep pushing me further and further for something that I didn't think that I'm gonna do that. And and in Speed School of Engineering, there are some female professors, and I'm Associate Dean for Student Affairs, Dr. Dipoy, and of course Dean Bain from graduate school. They are all, of course, female, and they've been role models for me, because I was looking at them and saying, okay, they are strong, they believe, they are kind, and they really help. They really helped me and supported me in any way that they could, and I'm really, 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 really thankful for that.
So you found some females that were on the faculty, but not a whole lot of females in the classroom.
Yes,
as your fellow
yes,
students,
that's interesting.
Right?
Yeah,
Okay.
yeah.
That is kind of interesting. Do any of you plan to go back to your home country, or do you all plan to stay in the United States?
So for a while we want to stay here. At least I want to stay here because I still want to explore. I want to learn more. I want to go out and see companies and see the technology. So it's really, really exciting for me.
Okay, so you're going to stay here for a while. Have you got a job lined up?
Yes, I have a job. I'm going to join Apple.
Apple?
Yes.
Like the computer Apple?
Yes,
oh,
Apple.
So what are you going to be doing for Apple?
Yeah.
What are you going to be? What's your job?
So I'm going to be a data scientist over there, and I'm going to work with fraud detection team. So basically, I'm going to help them to detect any fraud that's going on with iTunes accounts or different type of stuff.
Mahsa Badami, thanks for being on the show, and congratulations on your PhD. Thanks for listening to UofL Today, and go Cards.